We start tonight with our continuing coverage of COVID-19. The vaccination process in Idaho is moving into a new phase.
Starting Monday, all Idahoans 65 and older will be eligible to receive the vaccine. Health districts throughout the area are working hard to make sure the rollout runs as smoothly as possible, but there is a limited amount of shots available. There are about 250,000 new people in Idaho that are now able to get the shot. Even so, the health districts remind us that it will take time to vaccinate everyone.
We understand that people want to be vaccinated as soon as possible, and we want to be able to provide that to people. But the name of the game right now really is just for us all to be patient and know that we are getting a steady supply. We are getting it out as quickly as we can. So for example, when we open up our appointments for this group on Monday, we are going to be scheduling up to 8 weeks out at a time.
Each health district has a different way to sign up for the vaccination. We have each of those on our website at localnews8.com.
And getting people vaccinated as quickly as possible is becoming more urgent, and new variants of COVID-19 are starting to show up in the U.S.
It's a mad dash for protection against COVID-19. Hundreds racing to this Seattle hospital to get vaccinated late Thursday night.
I put up the back call and we arrived within, like I said, within an hour and a half.
Workers realized there was a refrigeration problem, so 1,600 doses were quickly administered instead of going to waste. In Maine, Doug Renfrew drove 10 hours round trip to get his shot after local clinics canceled appointments due to a lack of supply.
Not first choice, but it's the only choice.
Anything for a shield against those highly contagious variants detected here in the U.S., from Brazil, the UK, and now South Africa, with 2 people in South Carolina testing positive for that mutation with no travel history.
It is an incentive to do what we've been saying all along, to vaccinate as many people as we can, as quickly as we possibly can.
But the big question is, will vaccines work against these variants?
And so we saw less efficacy in the South African trial. But I think what is important to remember is that it still showed some efficacy.
Johnson & Johnson says its vaccine is 66% effective against moderate COVID-19, 57% effective in South Africa, and more so when it comes to serious cases.
We have 85% protection against severe COVID, irrespective of where in the world you're talking about and what kind of variant you're talking about.
They're expected to request emergency use authorization for their single-dose vaccine next week, and if it gets the green light, it could go into people's arms by the end of February.
Meanwhile, other pharmaceutical companies are also tracking these mysterious variants. Moderna is studying a possible booster shot to protect against the South African variant, and Pfizer says they're prepared to make changes to their vaccine if needed. Rena Roy, ABC News, New York.
So far, none of those variants has been found in Idaho, but there has been at least one case of the UK variant reported in Teton County, Wyoming.